was a Monday morning. As I went to work, it was actually my third day at this store. I went in, I guess, about 6 o'clock in the morning is my usual starting time. It must have snowed that weekend before because I cleared snow and ice away from the fuel islands. After I did that, in the morning I came inside to warm up and warm up some lunch.
He came in and he went to the microwave to put his lunch in there to heat it up, and got this blank look in his face. We'd asked him what's for lunch, and he just stood there and a blank look on his face, and down he went.
I had collapsed here on the floor. There were two customers that were here that actually saw me go down and came over and started performing CPR on me. I do believe I was dying or dead. I do remember seeing my son who had passed away, and my dad who had passed away also in the 1970s, and seeing them, greeting them, we hugged, and then I was pulled back.
Bob experienced what we call an out-of-hospital cardiac arrest, and where because of blockages in his heart stopped beating. When your heart stops beating, it stops sending blood to your brain, and as a result you faint or you collapse, and there was no heartbeat, and there was no heart rhythm, and there was no blood flowing to his brain. Fortunately, someone was able to restart his heart and get his heart going, but his brain had been injured as a result of the time that it hadn't been receiving the blood flow.
One of the doctors that approached me and said they were going to try this new device that could give Bob a better chance to survive, and I'm like, yeah, let's do it. I'll sign. Where do I sign? And I mean, anything that would give him a better chance, I was all for it.
He was one of the first people in the country to receive what we call therapeutic hypothermia, which means that when they're in a coma as a result of out-of-hospital cardiac arrest, we'll cool their body temperature down, similar to putting ice on a sprained ankle. When an ankle is injured, you put ice on it to prevent further injury or secondary injury to the ankle, and it's the same logic in that he came and he had an injured brain as a result of that, and so we quickly did all that we needed to do and cooled his body temperature down to 92.3 degrees. In order to do that, you have to paralyze patients because they shiver, and shiver generates heat, so you paralyze people, and then because they're paralyzed you have to put them in a coma just in case they would wake up on their own, and you give them pain medicine, and then you keep them cold for about 24 hours, and then you rewarm them over the next 12 to 14 hours.
Bob's brother was there in the morning just when he was starting to come out of his coma, the first signs, and he had come to the group of us that were like in the waiting room, and he said, I talked to Bob, I said his name, and he turned and he looked at me like he really knew, like a deliberate look, you know, like he was there. And we were just kind of excited, and we kind of went back into the room and said, Bob, can you give us a sign? Are you doing okay? Can you give us a thumbs up? And Bob raised his thumb like that, thumbs up, and we're all just like, all right, you know, he's coming out of it.
If I was not cool, I believe that I may have survived. The chances of me surviving at all were really grim, and if I had survived, I would be in a nursing home at best. I don't think I would be able to function on my own at all.
The quicker that people get perfused, understanding and knowing good CPR, not just any CPR, but good CPR, understanding and where and how to use an AED, quickly getting them to the hospital and quickly getting them to a place that can do therapeutic hypothermia is all the pieces that increase your chances and double the survival rate.
Where we come from is smaller. They don't have a heart unit. This is the one that people want to go to if they have heart problems, and I have no problem telling them that. You know, go there. They've got good doctors. It's a good hospital for many things.
I believe that fewer and fewer hospitals are going to want to provide critical care medicine in the outlying areas around St. Cloud because it's very expensive, it's very complicated, and it's very manpower intensive. The standard of care for a person living in a small town should be the exact same standard of care as it is to a person living in a large town. Having more space will allow us to provide that simply the best care that our ICU and CCU and Heart Center strive to perform to more people, because we'll be able to take care of more people than what we have now.
I can't say enough thanks to the people at the hospital themselves either, because that is one of the things I probably have felt the worst about, is not knowing those people and personally be able to thank each and every one. I can't give enough thanks to everyone.